Of the third party.
Thank you, Honourable Speaker. It's astonishing to hear this conversation back and forth between the two parties and to be discussing climate change and to hear this government talk about their climate change plan and ignore the fact that they doubled the public subsidies to oil and gas that the previous government had to $1.3 billion a year. This government is funding climate change. It is funding these outcomes with public money. This province is facing overlapping crises, Honourable Speaker. We have the heat dome, we had the wildfires, and we are now in the fourth wave of this pandemic. And one of the communities the hardest hit is the unhoused. As this government touted an early and premature recovery from COVID at the beginning of the summer, supportive housing options to isolate safely were quietly rolled back. A September memo in Vancouver Island Health referred to us being in the endemic phase of COVID and stated that the official response to unhoused people with COVID-19 is to give them a snack, a mask, and education. And in my riding, that meant a 66-year-old man with COVID and nowhere to go, and COPD and a fractured hip was given the advice to sleep in his vehicle. And now the crisis has reignited after hundreds of cases of COVID-19 were diagnosed in Victoria's unhoused population last month. The government hastily promised 50 new beds for people to use to isolate and recover. But the number of beds is inconsistent with the number of cases, and people don't have a month to wait. They're sick, it's getting colder, and the virus is spreading. Honourable Speaker, my question is for the Minister of Health. All of the data this summer showed that the pandemic wasn't over. Why in September were health authorities rolling back supports for unhoused people when the data pointed very clearly to a rising fourth wave?
Minister of Health.
Thank you very much, Honourable Speaker. Some of that question is for the Minister of Housing, so he may respond on the second supplementary to the member's question. But what I would say is this: we are in the fourth wave of the COVID-19 pandemic. That's the position of every health authority, and that's my position. That's why, in our step-by-step reopening plan, we're still at step 3. It's why we did more tests in the month of September than at any time. And our focus from the beginning of this pandemic has been to focus on those who are most vulnerable in every way, whether they're in long-term care, in assisted living, or they're most vulnerable in the community. I am very proud of the work of health authorities in communities around the province that we started in congregate living circumstances to vaccinate people and continued that effort. While we provided unprecedented housing options and isolation options for people. There are challenges now, because as the member will know, some of the facilities that we did, some of that cohorting of people who are sick are now being used for guests and visitors and so on. Nonetheless, it is an unprecedented continuing effort to support, to vaccinate our most vulnerable people. I think the fact that we did it early and the fact of that effort, I think, created maybe a false impression that we were ahead in those areas of everywhere else. The downtown east side, for example, of Vancouver has over 80% of people vaccinated, about 82%. Nonetheless, that is below other community health service areas in Vancouver. So we started there soon, but they were overtaken when it was offered to everybody. The efforts to vaccinate, the efforts to support, the efforts to house continue unabated and will continue unabated as we deal with this phase of the COVID-19 pandemic.
Leader of third party on a supplemental question.
Thank you, Honourable Speaker, and thank you to the Minister for his response. However, there is an online memo in Island Health that clearly states we're in the endemic phase and that there won't be supports provided to unhoused people, September 21st. COVID isn't just impacting unhoused people in Victoria. Across the province, unhoused people are getting sick and have nowhere to go. In Kelowna, 130 cases in the unhoused population weren't even recorded on Interior Health's list of public exposure because it wasn't, quote, a risk to the public. But unhoused British Columbians are the public, and they are at risk. These are people with lives and loved ones, people who deserve the supports they need to keep themselves and their communities healthy. The similarities between this and the lack of action on the drug poisoning crisis are striking. Unhoused people do not receive the same level of care or investment. My questions for you, Honourable Speaker, is to the Attorney General and Minister for Housing. Yesterday, the Minister said that his government is working to find isolation spaces for unhoused people in Duncan, Nanaimo, and Prince George. When can unhoused people in these and other communities across the province expect to have their needs met urgently?
Attorney General.
Thank you very much, Honourable Speaker, and thank you to the member for the question. There are a number of assertions the member made in her question that are not accurate. People who are COVID positive in Victoria, who are unhoused, can come inside if they choose to. We have space. The same is true in Vancouver. The same is true in Kelowna. But it is not the case across the province, and I accept that. We have a very serious situation in Trail. And BC Housing is working overtime with health authorities and with our nonprofit partners to make sure that if people are COVID positive and they want to come inside, because frankly, not everybody does, that they're able to do that. I would just underline the fact that the member's question starts at a certain point in time, omitting all of the work that was done by health authorities, by BC Housing, by nonprofit organizations to get people inside. 300 people were living in an encampment in Strathcona Park, 250 people in parks in Victoria. All of those people are housed now. They're inside. And it was a heroic effort by BC Housing and by nonprofit organizations, and that work continues. And the system is stretched. It is strained. People are working overtime. Staffing is stretched to the limits, and even so, 50 additional spaces were opened in Victoria to respond in time to make sure people could get inside if they wanted to. So a huge amount of work is done. I just want to thank everybody who helped deliver those results and who is still working overtime to respond to the fourth wave across the province.